Have you ever wondered what people are searching for and how those searches connect to real life? Thanks to Google Trends, we now have a unique window into the way Americans think about cancer, diabetes, obesity, heart disease, and more. And the results are fascinating. From 2004 to the present, search interest in cancer has steadily increased. People are asking Google about symptoms, treatments, and prevention more than ever before. But here is the big question. Do regions that search more about cancer actually experience higher cancer rates? Or does awareness help reduce the risk? Let's break it down. According to Google News Lab and Schema Design, certain regions in the Midwest and Northeast show the sharpest increase in search interest for cancer, while states like California, Texas, and Idaho show less dramatic change. This suggests that people in some parts of the country are more engaged or maybe more worried about health risks than others. Now, when you compare search data with real-life mortality rates, some eye-opening patterns appear. For example, in many places, high search interest lines up with high occurrences. Conditions like cancer, heart disease, stroke, and depression follow this trend. This makes sense. When a disease affects your community, people naturally turn to Google for answers. But in other cases, the opposite is true. With obesity and diabetes, many regions show high search interest but relatively low occurrences. Could this mean awareness actually lowers risk? Or maybe people are more anxious about these conditions, even if the actual numbers aren't as severe. On the flip side, some regions with low search interest actually suffer from high occurrences of obesity and diabetes. This is worrying because it suggests a lack of awareness could lead to higher health risks. Take obesity, for example. According to the Obesity Society, nearly 90% of people living with type 2 diabetes are overweight or obese. Excess weight places added pressure on the body's ability to use insulin effectively, making diabetes far more likely. If people aren't searching, they may not be aware of this critical connection. And then there are the outliers. Rochester, Minnesota ranks as one of the highest search areas for cancer, but has relatively low cancer occurrence. That could mean heightened awareness and proactive health measures are making a difference. Meanwhile, places like Wichita, Kansas show very high obesity rates, but surprisingly low search activity. Are people simply ignoring the problem? So what does all this mean for you and me? Well, Google search data isn't just about curiosity. It reflects real concerns, anxieties, and sometimes denial. Where there is awareness, there's often prevention. Where there is silence, problems can grow. This also raises a bigger issue. In the age of the internet, are we letting search data replace professional medical advice? While Google can give us quick answers, it can't replace doctors, regular checkups, or real diagnosis. The fact that searches for cancer, stroke, and depression are rising may reflect better awareness, but it may also reflect rising anxiety and fear. The bottom line is clear. Paying attention to your health matters. Searching is a start, but acting is what really counts. Whether it's cancer screenings, healthy lifestyle changes to prevent diabetes, or simply managing stress to lower heart disease risk, being proactive can save lives. So here is my question for you. Do you think people in your area search enough about health? Or do you think awareness doesn't always match reality? Drop your thoughts in the comments, because this is a conversation we all need to have. And if you want more deep dives into trending topics, from health to technology to global issues, make sure to like, subscribe, and hit the notification bell. Awareness is powerful, and together we can use knowledge to make healthier choices for the future.